The following is a presentation about the evaluation plan for the Healing Your Heart Through Food and Exercise Nutrition Education program. The purpose of the evaluation was to determine the effectiveness in the short, intermediate, and long term for the Healing Your Heart Through Food and Exercise Nutrition Education program. This evaluation looked closely at both the process and outcome portions, as you can see in the slide above. It documents methods to collect both quantitative and qualitative data regarding these outcome measures. Finally, the evaluation will propose avenues for the communication of results and impacts on the surrounding environment. The target audience for this program was senior citizens aged 65 and older who took part in a pre-existing lunch group that met 2 times a week. In addition to the target audience being a stakeholder, the organization that the program was held at was also considered a stakeholder in this evaluation program. The program itself used several activities such as a self-risk assessment, group discussion, physical activity modeling, and SMART goal setting to help promote heart-healthy behaviors, such as decreasing saturated fat intake and increasing physical activity. In addition to this first pilot program session, several follow-up sessions will take place in order to discuss current goals and help individuals set new goals in their path to reducing cardiovascular disease. This current slide showcases the logic model that was used to develop the evaluation program. All the way on the left-hand side of the model, you can see the inputs and resources that will be used to carry out the program. Minimal resources are needed, but things that are important are technology, such as having a computer and projector, having the handouts posted and printed ahead of time, and a knowledgeable program leader is key in the development of this program. In the middle of the program, we can see what we spent a lot of time in the last course discussing, which is how this connects to the social cognitive theory determinants. Moving on, we can see several of the intervention activities in the middle of the screen, such as the self-assessment, mini lectures, and discussions that I previously discussed. With all of those outputs, we should see a series of short-term, medium-term, and long-term outcomes. In the short term, we hope to see things such as change in self-efficacy and SMART goal behaviors. In the medium length outcome, we hope that we can see a decrease in saturated fat, an increase in physical activity, as well as an increase in the ability to partake in the action plan creation. In the long term, those behaviors should then lead to a decrease in LDL cholesterol levels, decrease in hypertension, and then an overall decreased incidence of cardiovascular disease in individuals who took part in the intervention. A few environmental things that we hope to also affect would be to impact the programs that occur at the lunch, including more nutrition-based programs, as well as affect some of the assisted living facilities. The evaluation design for this program is a non-experimental pre-test, post-test design, where a group of individuals is measured, tested, in this case given a survey, then they have the intervention and then are again measured after the intervention. Most portions of the process in short-term outcome evaluation will be measured using Likert scales like the one on the bottom of the screen. This Likert scale was created by myself to measure the self-efficacy of identifying saturated fats in foods. In order to indicate that this measure has been reached to a satisfactory level, the goal of the program is that 80% of individuals will have a 20% increased perception, which would be moving one level on the Likert scale, of self-efficacy in relationship to reducing saturated fat intake. Each measure or outcome that was located on the logic model has its own separate standard of success. In addition to the Likert scale surveys that will be administered pre-test and post-test, there will also be the use of qualitative data through an illumination evaluation. The purpose of this is to help prevent participant attrition, which can be one of the biggest issues when working with individuals who are older. After collecting data from pre- and post-test surveys, paired t-tests will be used to determine statistical significance in the design. Once this is determined, practical significance will be interpreted with the aid of calculation of confidence intervals. The main source of interpretation failure may come from participant attrition. This will be combated through careful monitoring of participant withdrawal from the program, as well as determining how this has an effect on the statistical power of analysis. Findings will be used for program revision and determining the number of follow-up sessions that will be needed for the greatest effect. The communication will be delivered in a group format with all stakeholders present so that participants, one of the stakeholders, thoughts can be heard. This places an emphasis on making sure that the stakeholders' voices and opinions are heard, hopefully reducing the amount of attrition throughout the program. In the communication, the emphasis will really be on the practical significance of the data and reassuring individuals that making a change this late in life can truly have an effect